Reflecting on the last 2 years, the recently appointed head of Ontario's COVID-19 Science Advisory Table is proud of what they accomplished, from the collection and analysis of COVID data to the guidance it offered decision makers.
Whether it was the need to prioritize vaccinations in high-risk groups like lower-income neighborhoods or among the elderly, whether it was the need to think about how to protect our long-term care sector, I believe that the work that we've produced has helped our response in a very difficult time.
Frontline doctors say they've relied on the table's work since it was formed in July 2020.
I think that they were extremely helpful.
From an ICU perspective, it helped us understand what we needed to prepare for.
The table says it was informed by Public Health Ontario that it would be disbanded as of September 6th. Ontario's premier said the work of the group will continue.
We aren't dissolving it. We're actually transferring it over to Public Health.
A statement from Public Health Ontario suggests it's looking at forming a new group. It says it's been engaged in discussions with Science Table members throughout the process. Doctors say they still want the guidance the table provided, especially as hospitals grapple with staff shortages.
COVID isn't over just yet. We still have a high burden of illness within the hospital.
We're in a major human resource crisis in our healthcare system. To enter the fall with a potential surge and be fine without the scientific table's insight, I think, makes people nervous.
At its peak, the Science Table's core membership included more than 40 health professionals and scientists with a broad range of expertise. Public Health Ontario says it will have more information to share next week. Dr. Fahad Razak will be watching.
We're at a very high-risk point in the pandemic, and we've had many difficult stretches. Unfortunately, this is one of them.
Talia Ricci, CBC News, Toronto.